How does lung cancer staging guide wedge resection? Imagine you're trying to decide the best way to remove a small, early lung tumor. Lung cancer staging is like a detailed map that guides surgeons on the safest and most effective way to operate. It looks at how big the tumor is, where it is located, and whether it has spread to nearby lymph nodes or other parts of the body. This information helps determine if a wedge resection is a good option. Wedge resection is a surgery that removes a small, wedge-shaped piece of lung tissue containing the tumor along with some healthy tissue around it. It's usually considered for early-stage lung cancers, especially when the tumor is small and located on the outer part of the lung. The size of the tumor is a key factor. If the tumor is 2 centimeters or less and there's no sign of spread to lymph nodes or other organs, wedge resection can be a suitable choice. For tumors larger than 2 centimeters, the risk of the cancer coming back locally increases if only a wedge is removed. In such cases, more extensive surgeries like lobectomy, which removes an entire lobe of the lung, might be better. When the tumor is very small, 1 centimeter or less, wedge resection can sometimes offer survival rates similar to more extensive surgeries, especially if other favorable factors are present. Location also matters. Tumors near the surface of the lung, called peripheral tumors, are easier to remove with a wedge because surgeons can get clear margins without needing to cut through major blood vessels or airways. Central tumors, located near the lung's center or hilum, are more challenging because they are close to vital structures. Removing these with a wedge might not be enough to ensure all cancer cells are gone, so more extensive surgery is often needed. Another important aspect is the tumor's appearance on imaging scans. Tumors that look less solid and have a low consolidation-to-tumor ratio, like those seen in certain types of adenocarcinoma, are more suitable for wedge resection. If the tumor shows invasive features, such as spreading into nearby tissues or blood vessels, wedge resection might not be enough to control the disease, and more aggressive surgery could be necessary. Achieving clear surgical margins is essential. Surgeons aim to remove the tumor with at least a 2 centimeter margin or a margin that is at least as large as the tumor itself. This helps reduce the chance of cancer coming back locally. The staging process helps determine if this is achievable based on tumor size and location. Lymph node involvement is another critical factor. If staging shows no cancer in the nearby lymph nodes, wedge resection can be considered a curative approach. However, if lymph nodes are involved, more extensive surgery that includes removing and testing these nodes is usually required to ensure all cancer is addressed. Finally, the patient's lung function plays a role. Wedge resection preserves more lung tissue than removing an entire lobe, making it a good option for patients with limited lung capacity or other health issues. But it's only suitable when the cancer is early and has favorable features based on staging. In summary, lung cancer staging acts as a guide to identify which early tumors are best suited for wedge resection. It helps doctors choose a less invasive surgery that still offers good chances of controlling the cancer while preserving lung function. When the tumor is small, located on the outer part of the lung, and has no signs of spread, wedge resection can be a safe and effective option. For larger or more invasive tumors, or if lymph nodes are involved, more extensive surgery is usually necessary for the best outcome. Always remember, personalized treatment planning with your healthcare team is essential to find the most appropriate approach for each individual.